السلام عليكم وتحياتي إلكم. This is the class about bioethical research, and we will be speaking about ethics today in order to understand what is the research that is made ethically, بأخلاق, and that respects بتحترم الإنسان بكليته. So bioethical research. We will be introducing ethics. هنتكلم على ethics وهنتكلم على mechanism of research review and monitoring, مراجعة ومصادقة الريسيرش لما بيعملها الواحد، و research misconduct معناته سوء سلوك الواحد الباحث الطبي ولا scientific research. Why are we talking about ethics? فكلنا بنعرف شو اللي حصل مع النازيز. كانوا عملوا research على prisoners, and they wanted to create science, but they did not respect dignity and the human wholeness. فعملوا, for example, here في freezing experiment, they took the prisoner and they put them in ice and they measured their temperature to study what happens in somebody like this. There is also Dr. Josef Mengele, who used prisoners in Nazi concentration camps for medical experiments. And that led to the Nuremberg trials. The Nuremberg trials were in November 1946. وهدول الأطباء والباحثين that were in those unethical trials and research. And after that, the Nuremberg Code came out. If we are going to be talking about ethics in research, this is something you must know. And it talks about you have to have voluntary consent. Voluntary consent is the cornerstone of research. معناتها الموافقة الطوعية. So the person is wanting to be in the trial, understands اللي ماله وما عليه. That Nuremberg Code is extremely important to know for ethics before you do any trial. And then after that, we will be talking about it should be yielding fruitful results, نتائج اللي بتكون بتعاون بتساعد society. The experiment should be designed so that the results of animal experimentation and the knowledge of natural history of the disease will justify the performance of the experiment. فنستعمل كل المعلومات اللي كانت قبل من الترايل اللي الواحد بده يعمله عشان تقنع إنه البنفيت أكتر من الريسك. No experiment should be conducted just because we believe that death or disabling injury will occur, except perhaps if those experiments where the experimental physicians also serve as subject, which means no experiment should be conducted. I invite you to continue reading the Nuremberg Code in order to know what it means to be in a research trial. This is also very important. تاريخ البحث العلمي هذه بحث كان مهم جدا لأنه a Tuskegee syphilis study, what happened with it is that the US government did a study where they gave an infected a population of African American, and unfortunately, they denied them penicillin even as it became available. And so from there, we now have a code of ethics for research. The code of ethics for research states إنه الريسيرش لازم يكون عندها نفع للسوسايتي. It helps health, psychosocial, or any other value to the individual participant. So any research لازم يكون عندها قيمة, even if that value is not monetary, but it has to be health-related, social, psychosocial, etc. And it will contribute to the acquisition of generalizable knowledge, which means that it will add to the knowledge already that we had. Meaning بتضيف إلى المعرفة اللي كانت for that topic that the research is being made for. Now, why do human subjects need protection? Well, we saw when people want to do research with subjects that were not protected that led to the Nuremberg trial. لما يكون واحد عيان, they're vulnerable. And vulnerable means that when there is somebody who's vulnerable, they need protection. For example, لو فيه دواء جديد بس حنديه للchildren, and these children are vulnerable, they need protection. So there is an organization that protects patients, and we will be talking about it. فهدول الethical principles involving human research. You have to familiarize yourself with these two. Beneficence, meaning في إفادة. It's not just for curiosity. You have to be able to show that you benefit humanity. And you have to be able to show that you are not harming humanity, that you promote the well-being, maximize the benefit, and minimize the harm. In addition, the second one is respect for the person. احترام للذات. فبنحترم ايه؟ بنحترم autonomy، معناتها الحكم الذاتي للشخص. هيدي أول حاجة. والثانية the privacy. privacy معناتها الخصوصية. فنحترم الautonomy and the privacy للأشخاص اللي بيكونوا clinical trials. وآخر حاجة اسمها justice and fairness. justice عدالة، وfairness إنصاف. These are the ethical principles: beneficence, non-maleficence, respect for persons' autonomy, privacy, justice, and fairness. Who are the responsible parties in research safety? The first one is investigators, اللي بيعمل research. The sponsor, اللي بيمول research. Institution where research happens. والlocal committees. هدول local committees بيتسموا IRB. An IRB means Institutional Review Board. And institutional review boards means that they are مجالس للمراجعة في المؤسسة. So بيراجعوا البروتوكول وبيثبتوا إنه في beneficence, not maleficence, and justice, fairness, respect. كل هدول بالبروتوكول. فال-IRB is the protector of the patients, and it falls under the Office of Human Research Protections and the Food and Drug Administration. If we look at the institutional review board, there is also independent ethics committee. ففي مجالس المراجعة، بس في مجلس تاني اسمه independent ethics committee. هدول independent ethics committee بيكونوا بالمؤسسة نفسها مش بالفederal. The IRBs, they fall under the FDA and the Office of Human Research Protections, but also they can be institutionally local. It is a committee that approves, monitors, and reviews the research involving humans. ليش؟ to safeguard the rights, the safety, and the well-being of all trials. Those are the pillars of human subject protections. Remember that. The Independent Review Board, the IRB, and the informed consent, المواثقة. So once you have the participants signing an informed consent معناتها خدوا المعلومات كلها بالريسك and benefits. بس واتكلمنا على البحث اللي بيخص الأطفال or prisoners or the elderly or pregnant women. فهدول عندهم limited comprehension ولا limited access, and they need to be protected. Why? Because they are vulnerable. So whenever you have vulnerable populations, معناتها في فئات من السكان ضعيفة ولا محتاجة محتاجة للحماية, they fall under the IRB and the Independent Ethics Committee. What is the goal of a local committee? حماية research subjects, make sure they're not exposed to unnecessary harms or risks. في مثال, لو عندي a drug I want to, well, a medication I want to test, I give it to a patient, but I want to do blinded, I want to do placebo. You need to prove that the placebo also is harmless. It will not harm the patient. So all of these unnecessary harms and risks fall under the aims of the local committee. They also protect the investigators and co-investigators. The person who's carrying the research, الباحث العلمي, and ensure that vulnerable groups are not abused in the research. They also guarantee the safety. What are the duties of the local ethics committee? We talked about the IRB. This is the ethics committee. They approve the research project from the ethics committee. And number 2, ensure that the research is compliant with the law, ممتثلة للlaws and policies in place. Number 3, ensure the validity of the procedure for obtaining informed consent. And the informed consent معناته إنه موافقة the research subject, and the research subject have to be given all the information, negative, positive. Perform periodic follow-up. Just because they said yes doesn't mean you just leave them alone. You have to prove to the ethics committee that you will be following this person for as long as needed to ensure that they are safe. Sometimes it's 4 weeks, sometimes it's 4 months, sometimes it's 4 years, sometimes it's 14 years. You monitor the well-being of the human subjects, and you coordinate with the monitoring office. Which research requires the local committee review and approval? All of it, especially if it involves living human subjects. If you want to do research on animals or the laboratory, you don't need local committee review of approval. But once you involve humans, you must. You also must involve the local committee approval if you have human biological material. مثلا if you have blood samples. فأي بحث في مواد بيولوجية بشرية, you have to also require local committee, even if these are not involving somebody at that moment. Human biological materials, human embryos, fetal tissue, reproductive materials, and also stem cells. And stem cells are الخلايا الجذعية, meaning they are خلايا that can turn into any of the cells of the body. All materials from living or deceased humans. If you have something, a biopsy from someone, that becomes a human biological material, and you require local committee. I hope that is مفهوم. Something very important. If you want to become a research person, if you want to do a research, you must have your signature on the proposal. بمضي عليه, this signature, what it says is that it compels me, بتجبرني على إنه أتبع وأمتثل all of the proposal, and I do not deviate from it. If I said I'm going to take your blood pressure 3 times a day at 9 a.m., 10 a.m., and 6 p.m., I must do it at 9 a.m., not 9:01, not 8:59, 9 a.m. And that means that there is a trust, ثقة, من subjects that agree to be in my research, that I will follow my research proposal. There is also that the informed consent must be obtained. مو ممكن أعمل أي شيء قبل ما أخذ informed consent, الموافقة بس المستنيرة, معناتها إنه أنور العيان وأقول له البوزيتيف والنيجاتيف, عشان لو ياخذ قرار يدخل على البحث العلمي يكون هالقرار informed. في مرات where we ask for an expedited review. شو معنات expedited review? Expedited review معناتها مراجعة مستعجلة. expedited review, when there is a project not carrying more than minimal risk. There's no risk. Maybe the risk is blood draw. هياخدوا له الدم. That's it. It's not going to be giving the patient any medication or surgery or anything. Very minimal risk. Maybe the risk is just they have to walk 50 متر. That there's minimal risk. Maybe the risk is that they're going to fall or they're going to get short of breath, but it's minimal. Or لو already there is a project موافق عليه من IRB وبدي أعدل شغلة فيه, أغير the time of something, ولا I bring in somebody else, ولا my sample size كان 50 عيانين دلوقتي حتكون 60 ولا 70. So whenever I modify, minor modification, والشغلة الثالثة, it's reviewed by the local committee, chairman, and the members in the next meeting for a decision. Okay? So, like for example, لو في blood pressure device that I'm trying something new in it, ولو في biological specimen, saliva, urine, there is no risk to the patients themselves, ولا minimal risk. لو في data collection, I just want to review the medical files of the patient. Material is already collected. I already have it in my freezer. ولا continuous review of a project already done. I just want to do a long-term follow-up. فلما بنقول minimal risk, خطر قليل كتير, شو بنسمي risk? What is the definition of risk? The definition of risk means the probability of harm and the احتمال إنه يكون في harm ولا discomfort. What is minimal risk? That the probability of that harm or discomfort is not more than what you would get in normal life. For example, I want to do an X-ray. It's a little bit more minimal than usual than you would get in a normal day, or taking a blood draw, etc. What are some of the problems that the IRB finds in, let's say I sent my project and now they're monitoring me? They may find that I do not know enough about research regulation. If I don't, I have to hire somebody who does. They may find that I have a conflict of interest, meaning conflict of interest means تضارب المصالح. Meaning my research is on a drug that I am developing and I'm going to benefit from it. And I'm using a business of patients that I also have in order for me to benefit myself. في financial conflict of interest. Well, they can find that there was an insufficient project review by the IRB, meaning the المراجعة ما كانتش كافية. Maybe they just reviewed the first page. Maybe they just reviewed a table. Well, في unplanned review of research project. You started to do a research project and in the middle you said, you know, I'm just going to start to look at their blood pressure. You can't do that if you haven't already said it. And there is lack of attention of regulators. Maybe the monitors that need to come to monitor your project, to المراقبين. Maybe those did not come often. ما قمش عندك إلا مرة في السنة. هذه classified as عدم اهتمام المراقبين or عدم اهتمام regulators المنظمين. Okay? This is what's a conflict of interest, تضاد المصالح. إنه it's a set of conditions in which the professional judgment, الحكم professional حكم concerning a primary interest, meaning a patient welfare, ولا the validity of the study. Maybe I'm doing that study so I can benefit from the company by investing in it. فهدول الانفلونس is unethical. غير أخلاقية بالبحث العلمي. Non-compliance غير امتثال للpolicies and the law, meaning the IRB recognizes you did not bring the patient on day 3 as you said. You did not do the lab test to check for safety as you said. Once you start to have continuing non-compliance, meaning مرة واثنين وثلاثة. المرة الأولى, okay, we ask you to correct it, صححها. And المرة الثانية بنقول, okay, now we're going to watch. If it happens again, we need to stop you. There is continuing non-compliance. That means that it might be that you will have to stop what you're doing. And then the extremes. The extremes are when there is fraud and deceit. And fraud and deceit means غش وخداع. Fraud is wrongful or criminal deception. I did that on purpose in order to benefit from you. والغش, I did that on purpose not to benefit, but to just hide something I did. But there's a difference between the two. These are examples that we found. Ishaq Newton, we think he might have adjusted some calculations. Gregor Mendel, for example, results with pea plants were cleaner than what is observed experimentally, means he may have been polishing the data. Louis Pasteur also, he did not state in his studies that he used the vaccine against the anthrax made by a competitor. فهدول they hid the truth. بتسمى deceit. There are other examples in here, but I think you understood the concept. So how common is research deceit? ما مدى شيوع الخداع البحث في البحث العلمي? Well, the NIH survey showed that 1.5% admitted to lying, falsifying or plagiarizing. In a 2000 study, the Vioxx failed to inform the New England Journal that several patients had heart attacks on the drug. ففيه an entire industry of people that try to find if there has been deceit ولا غش research. So these are the definitions. Fabrication. Fabrication means the الباحث just made it up. يعني اختلقها. Or falsification. You have data, but you changed it, you manipulated it. Or claiming person's idea. It's somebody else's idea, بس سرقها الواحد and claims it as if it was him. فهدول سوء أخلاق بالresearch. Other forms, if you don't or I don't ask for ethical approval, that's misconduct. If I do not get informed consent from the patient, or if I even change the date to make sure it's compliant when I didn't do it that date, or if there is no missing data, so I just completely eliminate that patient altogether, etc., etc. And that means that you will be given a misconduct in research. Last week, we spoke about publications and manuscripts, okay? So in publication, نشر للmanuscript, there are rules for who is the author, the first author, the second author. فهدول, you have to follow them. The first author is the one that did the most. The last author is usually the mentor that helps with the... So most respected journals want to fulfill all these three conditions. You can only be an author if you have substantial contribution. You can't come in the end وتقول هذا ابن عمي, I just want to help him. How can I add his name to there? If he or she did not do anything in there, they have to have substantial contribution. Substantial means they can't just bring water to everybody and call I contributed. Drafting the article or revising it for important intellectual content. Sometimes you did not contribute to the research, but you contributed to writing the article or revising the article. And then the last one is the final approval of the version to be published. So those are three conditions to be an author, okay? Misconduct means somebody that changed scientific knowledge. كلمنا على الفابريكيشن، اختلاق، الفالسيفيكيشن، الغش. Misconduct that misleads the scientific community. Somebody who just created something or used somebody else to write the article. Maybe they took the same study and they published it again, but they changed the names of the patients and everything. It happens, unfortunately. This is one where we saw that there was a publication about MMR vaccine. It's one of the vaccines that we take and that it causes autism. Okay? This was actually already shown that it was not a good study. It has conflicts of interest. He received money from attorneys, highly selective of the اختاروا الداتا اللي they published. And they dealt with children without proper consent and they exploited them. So هذه research was already taken out. How do you take out research already published? Well, the journals, they can do an expression of concern. An expression of concern, journal يعربون عن قلقهم على هيدا research for some things they find, or correction, to correct a mistake, or retraction. Retraction is very important, and that means that بيتراجعوا على هيدي research that they published. So I need to end here, and we will have a next one, inshallah. Okay? Assalamu alaikum.